This segment of the Plastic Surgery Channel is brought to you by Galatea, now offering Galaform, the first 3D mesh for soft tissue support.
This is No Spin Live, and do we have a show for you today? You're going to hear what's happening in plastic surgery from the world's top plastic surgeons. Today we're going to be covering, is the facelift dead? Breaking news on Buttock Augmentation. And after his 60th surgery, Rodrigo is calling it quits. So our experts with us today are Dr. Jason Posner from Boca Raton, Florida, Dr. Sean Daugherty, and last but not least, Dr. Dan Maman from the Big Apple in New York City. Let's get into this first story. This is a story where they said the facelift is dead because women, facelift's down 44% based on their data, but they say women are opting for less invasive procedures. So what are you seeing, Dan, in your practice? What do you think about that? Well,
I think it's true. The reasons for it are multifactorial. I think that there's a delay in presentation and patients getting to us in this, and the reason for that is that there's a lot of other specialists, dermatologists, primarily that are doing non-invasive treatments and therefore delaying the necessity of a facelift. And the same is true for our practice. Certainly almost every single patient that we see for facial rejuvenation, we start conservatively with some type of filler or Botox or non-invasive skin tightening modalities. And then we slowly build the relationship with the patient, build their confidence in our practice and our treatment, and ultimately patients become surgical candidates. But I think that there's a delay, and it's things have progressed over the last decade.
Sean, where does it all fit? What do you think?
Well, I agree with Dr. Maman. I think that numbers are down a little bit, but I don't know. We're doing a lot of facelifts. I think that these non-surgical treatments are good, but if people think they're going to deliver a surgical result, they're mistaken. So we're still doing a lot of facelifts. I'm a big fan of non-surgical treatments. I think they're a good complement to things, but if someone needs a facelift, they're always going to need a facelift, and a facelift is what's going to fix them. I think that article should be fixed to be death to the overdone facelift, because I think nice, subtle, appropriate, natural facelifts are really what we're all doing now.
So Jason, I've known you for 20 years. You're like one of the world's experts on non-invasive procedures, and you could talk all day about that stuff, but I'm sure that you have some insight in so when, people obviously like non-surgical stuff, but there's some people that just benefit from surgery, right? So how do you sort that out?
Sure. So, let's go through this. First of all, this was a UK article. So in the UK, facelifts are down. So I actually did some homework prior to this No Spin Live. So I went back to ASAP's data for 10 years. For the last 10 years, facelifts in the US have bounced around between 120,000 a year and 127,000 a year, every year differing a little bit. So for the last 10 years in the US, basically facelifts have gone up and down maybe 5%. So this 44% down is maybe related to the UK, has nothing to do with what we're doing in the US. Secondly, listen, I love my non-surgical stuff, but all that stuff drives surgery to me. So I have doing more and more facelifts than I ever have because people come in for non-surgical stuff and they're not good candidates.
All right, well, that's good stuff. So let's go on to this next story. This next story is really a hot topic, and especially it's about buttock augmentation, or BBL for Brazilian butt lift. Many people have heard about it. There's been deaths. Actually, the death rate's been as high, quoted as 1 in 3,000, which is very high, for obviously a cosmetic procedure. But there's a multi-specialty, a multi-society between American Society of Aesthetic Plastic Surgery, American Society of Plastic Surgeons, ASPS, and then ISAPS, which is the International Aesthetic Society. And that task force just came out with some new guidelines asking people to reevaluate their techniques. So Jason, I know we talked about it before, but this is something new, kind of breaking news on this topic. So what do you think?
So, I missed Del Vecchio because, we were emailing back and forth about this, all week when this topic came up. The whole key is we've talked about this. And as Dan said, it's all in the training, better training, better training. So the take-home message from our side is stay superficial and don't go too medial. Matter of fact, I just saw a consult about an hour ago physician came in for liposuction and discussed fat grafting, and she asked me, first patient, about the incidence of fat embolus. And that was a physician. But the key is I actually went through this article a little bit with her. And the bottom line is it's better training on our end, board certified plastic surgeon with experience, stay away from the chop shops, and on our end, stay lateral and superficial.
The studies thus far have shown that the danger areas, these big veins that exist in the deep iliac veins that are quite big, and so the fat can kind of get sucked into those veins, and then people can have fat emboli. But what do you think the takeaway is here for people?
Well, first of all, for patients, just like Jason said, look for surgeons that are qualified and work in appropriate facilities and do appropriate surgery. But from my point of view, I kind of agree with Dr. Del Vecchio, who was on the show a lot, who at one point said maybe buttock augmentation can almost be a specialty, that there will be certain physicians who do this and who do it a lot, and then some who don't, and kind of like cleft lips and some of the sort of specialized procedures that we do. And perhaps this is going to kind of fall down that pathway.
I agree with what's been said. I think that we, as board certified plastic surgeons, as members of ASAPS and ASPS, we serve as the benchmark, as the guiding figures for safety profiles when it comes to cosmetic surgery. And I think if you look at the incidences that have occurred to date, I think the majority of them have occurred in the hands of non-board certified plastic surgeons. And certainly, the surgeons that have the most prolific accounts on Instagram or on Facebook advertising this procedure are really cosmetic surgeons. They're not only are they not board certified plastic surgeons, but they're not plastic surgeons to begin with. So I think that we, as a group, as a society, as an organization, it's very important to come up with guidelines so people understand the safety profile.
Yeah, no doubt. And this is some great work by that Joint Society Task Force. And there's also a study that ASERF and PSF just funded, and they're going to be doing more work into this. And just joining us late, we have Dan Del Vecchio, also from Boston. We were just talking about this joint multi-society task force statement on buttock augmentation, about technique. And Dan, you've been one of the people that has been instrumental in developing those guidelines, I think. So what's your takeaway for people on this release of new information?
The bottom line, Bill, is you need to stay subcutaneous in this operation. We pushed heavily in that task force to get a subcutaneous only mandate, and I was able to convince the powers that be to underwrite that. I think intramuscular injection of fat is dangerous anywhere you put it. Any fat put anywhere in the muscle can cause this problem, and anything under the fascia should be outlawed. My hat's off to ASAPS for doing this original work, and I think what you'll see in the near future from some research is going to really change the operation.
Yeah, Dan, I think Dan Maman made the point, and I agree that anytime you have a procedure that has a lot of growth and people are interested in it, like it's so true for buttock augmentation or BBL, you are going to have these people that aren't well trained that just want to get a piece of the pie, and so I think that for patients, they just need to understand that there's a lot there's a lot of homework to be done before you just go in and get a BBL done, right? Let's move on to our next topic. And this is a little lighter topic, but it's an individual that we all know well, Rodrigo Alves, who's had hundreds of procedures, but apparently he's had 60 surgical procedures, and he just had some ribs removed. I think that was number 60 or 61. He says, that's it, fini, no more surgery. We actually have not had Rodrigo on this show, but we've had his girlfriend, Pixie Fox, and Rodrigo is actually recovering from another surgery when we had her on. But what do you think about this? I can't imagine this is going to be his last surgery, just given the history.
I agree with you. I think I've met Rodrigo several times. He wanted me to do surgery on him. I think this is a classic problem of the patient with some type of leverage pushing the plastic surgeon to operate. You know, if you think about Michael Jackson pushed his plastic surgeon, who most of us know, to do multiple surgeries too soon, and we know what happened there. And I think with this, it's a little different, where you have the slightly famous, insta-famous person requesting surgery, and the surgeon can't resist. And the difference is it's not the same surgeon every time. It's one of 60 different surgeons. So each of them feels like maybe they could get some marketing out of it or whatnot. So there's kind of abuse on both sides in this kind of scenario. And I think it's unfortunate because Rodrigo, there are certain things he should just not be having this much surgery. No person should. And I think, you know, the problem is there's always someone willing to do it.
What's your read on Rodrigo, Sean?
I completely agree with Dan. I'm concerned about all these doctors that are actually doing these procedures. I think they're just almost as fault as him. I've never met the man, but he clearly has some level of body dysmorphia. And then he really has sort of an inappropriate relationship with plastic surgery. Like he paralleling it with career advancement, things like that. These are all things that we're taught to tell our patients that these things aren't associated with that. You should be doing surgery because you have a particular issue that you want to be treated. And lastly, he just has an aesthetic that I just don't really share.
So Dr. Maman, don't you think there's got to be some relationship between the number of surgeries you've had, and then it's almost like once you had a certain number of surgeries, you're going to be having more surgery because it's just in the maintenance of just all the surgeries, don't you think?
I was going to make the exact point. I think it's with near 100% certainty, it's inevitable that he has future procedures just based on potential complications that are going to occur from the amount of surgery he's had to date without knowing the exact procedures he's had. I mean, it's like, you know, if you put in breast implants in a 22-year-old patient, I mean, you can almost guarantee her that over the course of her lifetime, she's going to have at least one or two operations for revisional surgery, either implant replacement or some type of skin operation down the road. And the same is true for him.
You know, I don't have any patients quite like Rodrigo in my practice, but on the filler side of things, you know, we all have patients that push us and you're like, no, you're cut off, no more. And they're like, oh, please, a little bit more. So they're starting to look like Rodrigo over time. And then I see him and go, you're cut off for 6 months, you know, you got to come down. So I think it's something that happens to all of us, maybe not in the extreme as with Rodrigo, but we all have to kind of cut patients off sometimes and say, okay, enough is enough. You're not helping yourself or my practice with doing this.
You know, this won't be the last time we talk about Rodrigo. We need to have him on because he's definitely a person of interest for plastic surgery. So maybe we'll do a no spin and we'll all get together and we can just hear how Rodrigo talk about it. But anyway, I'm sure that you've enjoyed all these insights from our experts. And if you want to see more of this, you can see it on theplasticsurgerychannel.com.